Okay. Good morning, everybody. We're just going to give everybody a moment here to log in and get settled in, but welcome to Reopening Phase 2 webinar today. So again, we're just going to give it a moment and then we will be off and running in mere moments, I guess. Okay. We'll go ahead and get started here. So once again, good morning. Welcome to the Orange County IDA's webinar. Today we're focused on Phase 2 procedures and requirements for reopening New York. I'm Laurie Villasuso, the CEO of the Orange County IDA. This is the 9th in a series of webinars produced by the Orange County IDA to help Orange County businesses cope with COVID-19. We decided this week to revisit a topic we covered about 10 days ago, opening New York businesses. Phase 2 is set to begin tomorrow for the Mid-Hudson region, and we want to make sure you're ready. Before we begin, I want to let you know that next week's webinar will be on Thursday, June 18th, and it will focus on the PPP and loan forgiveness issues. As many of you know, the federal government recently expanded the time frame and usage standards for the PPP loan. We want to be sure we've got the best information for you to maximize loan forgiveness. So Josh Steele, a partner at Harris Beach, will join us for that presentation. He talked with us a number of weeks ago with the first phase there. So we'll be sending registration and information out by email, or you can check our website, ocnyida.com for details. Our goal for today, however, is to provide you with the information and tools that you'll need to complete the Phase 2 reopening process. To that end, please remember that you can ask questions through the Q&A dialog box on your screen. We'll answer them at the end, and we'll get to as many as we can today, and those we can't get to, we'll follow up with after the webinar. Today, our speaker is Klein, CEO of Galileo Technology Group. Peter also walked us through the Phase 1 reopening requirements, but she is a master's degree chemist, New York State licensed registered nurse, and has held executive positions in nonprofit organizations, healthcare facilities, and for-profit high-tech companies. Her career began in medicine, but over time she transitioned into high technology industries. She has a deep and diverse scientific experience base, which she applies to her work. She's well-versed in regulatory and compliance actions. Her writing skills successfully acquired grant funding for numerous organizations. She's known in our region as a strong leader, caring and capable, having demonstrated success across multiple industry sectors. She's a co-founder of a non-for-profit, the Solar Energy Consortium, where she managed over $9 million of federal and state grants. Peter is a co-founder, incorporator, and managing partner of Galileo Technology Group, a consulting firm that provides economic growth solutions to communities, such as business accelerators, as well as technical consulting services to manufacturing companies. We're pleased to welcome her as an expert and as my friend on the requirement companies need to meet and the procedures they need to follow to stay open or reopen in New York State. So with all that being said, Petra, I will turn it over to you.
Take it on the friend, but not necessarily the expert. So we're going to cover a lot of ground today, and I have to tell you that we could do a webinar on each of the industries that are opening just on that. So I have set this up in a way that we're going I'm going to show you where to go to get all of this information and what you have to do. Then I'm going to tell you what all of the businesses have in common, and then we'll go into some of the things that are extra in the industries. But there are three major topics or three major requirements, and it has to do concerning people, the place or your facility, and processes that have to be in place. The other is just making sure your business keeps up to date with the guidance. This is the New York Forward website. I've come to know this website very well, and it has everything you need, and everything I'm talking about in this presentation is coming from this website. So Phase 2 guidance is what we're going to take a look at. A couple of things on this page that are important. Here is a listing of the things that are not going to be open in Phase 2, and they're listed here. Over here are the industries and businesses that are launching in phase 2, and I'm going to go over all of them in more detail later on. One of the things that I couldn't find is what are phase 2 in-store retail. What is this retail rental? So I found some information on it, but if you're not sure if you fall in one of these categories, you can go into this New York Forward Business Reopen lookup. Before you go in there, you have to know what your NAICS code is for your business, and I'm going to show you how to do that. You can type in this code and then whatever your business is in the Google search bar, and it gives you the code. You're going to need this code for the next part to find out if your business is open or not, or in what phase it is. It asks you what county you're in, and then here it asks you what is your NAICS code, and I put that in. And so for nail salons in phase 2, it tells you it's currently closed. I did another one with furniture stores. So furniture stores are open with restrictions, and it tells you here specifically what the restrictions are. So if you're not sure if you fall into any of these categories, this lookup, this New York lookup is helpful to use, but you do have to know your NAICS code. So there are 3, for each category, there are 3 important tabs. The view the summary guidelines. This is a 4 or 5 page kind of cheat sheet on what you have to put in place, along with some best practices. And this presentation is basically based on this view the summary guidelines. This read an affirmation of detail. This is a longer, more detailed guideline specific for your industry. And it's 12 pages, 17 pages long. At the very end of this particular document, there is an affirmation you have to click in as the business owner or someone who's authorized to do this on behalf of the business, and say, I affirm and I attest, I read all these guidelines and that I will implement them for my business. The last tab is what I went over, I don't know, 10 days ago or so when phase 1 was open, on preparing a safety plan. Every business has to put in place a safety plan, and New York State tried to make it easy by having this template. And if you didn't see that webinar, I went over pretty much in detail how to fill out this plan for your business, so that might be helpful. So the guidelines, here, this is for essential, which would have been like grocery stores and pharmacies and so forth, and other retail businesses. And it gives you what you must do, and then best practices. And you should take a look at this for your business. In the reading and affirm guidelines, this is a more lengthy document, and it goes in quite a lot of detail on what's specific. And it is very helpful because it gives you examples of what you should do for your business. This last one is the safety plan. And as I said, I did a webinar about 10 days ago on how to fill this out. But all of the information I'm presenting today are in these three tabs. So for phase 2 reopening, these are the businesses that are being launched in phase 2. There are some restrictions, but these are the businesses. And I'm going to show you in the next few slides or so the mandatory requirements that all these businesses have in common. And then I'll go through each one and tell you what's a little different or extra about it. Sorry, folks, I didn't mean to click into that. So the very first requirement concerns people, and the basic thing you have to, however it looks in your business, is to do physical distancing. So you reduce the density of people to make sure you have 6 foot between anyone at any time in any direction. New York State still has in effect the 50% of maximum occupancy or capacity for an area. And this includes salespeople, workers, subcontractors, vendors, customers, tenants, their employees. Employers need to monitor the flow of traffic into and out of a business to ensure you're not exceeding that 50% capacity. You have to maintain the 6-foot distance for all, at all times with employees and individuals who come into your facility, unless the core function mandates that they be closer. In that case, they have to wear a face covering. You have to take a look in your business. Where do you have confined space or limited space where you might not be able to have that 6-foot distance between people and also maintain a 50% capacity? And these are some examples in businesses where you may have that limitation. You want to limit in-person gatherings as much as possible. If tele or video conferencing can work, then that should be done. If you're going to have a meeting, it should be in an open and well ventilated space and have the 6-foot distancing between people sitting side by side or face to face. And actually, this is what I was just saying, that you want to make sure that people are at least 6 feet apart. Here are some areas where that may be applicable. Now, for retail rental and barber shops, for retail rental, it's considering closing of the waiting room with having 6-foot markings outside the shop for customers. Retail rental is like renting appliances or electronics. It also includes home repair of appliances and that sort of thing. With respect to hair salons and barber shops, waiting rooms have to be closed. Walk-in customers who can't get a haircut or service right away have to be turned away until they can come when they can be served. You want to maintain social distancing in small areas and have markers, either tape or signage in common areas. And these are some other examples of kind of limited space areas. You do want to have a designated area for pickup and delivery so that you limit contact with delivery people as much as possible. You want to also, for either your customers or your employees, to kind of reduce interpersonal contact and congregation, either through adjusting your work hours, limit in-person presence of your staff, reduce your workforce on site. Remember, the 50% occupancy limit is still in place. You may want to consider staggering shifts. You can adjust or spread your customer and employee traffic over a longer period of time. And you have to make sure about distancing rules in restrooms where by reducing the capacity where that's possible. With respect to places, you have protective equipment. One of the other things is going to be cleaning and hygiene. Employers are required to provide their employees with acceptable face coverings at no cost to the workers. And you need to have adequate supply in case somebody doesn't have one or you need to replace it. The face coverings can be cloth, but if the work that you do requires a stricter PPE, remember that you need to use your N95 or face shield if the kind of work you do requires that. Some businesses might have to have additional PPE, and they're listed below. What is not clear in the guidance is why some of these PPE is required. The face shield for real estate, it doesn't really say why it's required. I can understand N95s or face shields perhaps in a barbershop or hair salon where you have closer contact with people. It goes without saying you don't share PPE unless it's completely disinfected and cleaned. You're required to train your employees or contractors how to put the face mask off and safely remove them, how to clean them, and how to properly discard the PPE. And this is really big if you're coming back into the work environment, is you're going to have to keep in mind what's about shared objects such as light switches, surfaces, door handles, and that kind of thing, that they be sanitized and that you wash your hands before and after contact. If a vehicle is required and more than one person is in the vehicle, everybody has to wear a face mask, and this includes test driving of a vehicle. For businesses that travel with interaction of customers, employees have to wear face coverings within 6 feet of a customer. And this is included in the rental retail, which is the home appliance repair or residential cleaning services. Anyone in a common area should wear a face covering, and anyone entering the business space wearing an acceptable face mask if they're above the age of 2 and they can medically tolerate wearing this. There's an executive order that came out. It's Executive Order 202.34, which says that a business, to enter a business, required to cover the nose and mouth with a mask or cloth face covering when in public place, including the discretion to deny admittance to individuals who fail to comply with this directive, or compel removal if they fail to adhere to the directive. Remember, the face covering, the Executive Order 202.17 requires face covering when the 6-foot distance can't be maintained. So keep that in mind. If you're within 6 feet and you don't have a face covering, businesses have this latitude to deny admittance. And I see in a lot of the shops that there are signs already that you're not allowed to enter if you don't have a face covering. But this executive order covers the business for that. With respect to PPE, I think I mentioned this already. Here's a list of some shared objects. These are going to have to be cleaned and disinfected, and employees also need to be cognizant that these items have to be cleaned after use and wash their hands. This is going to be new for phase 2 businesses entering this work now or reopening. There's a sanitation and hygiene requirement, and for common areas, common touch surfaces, and businesses are going to have to maintain a cleaning log on site that document the date and time and the scope of cleaning. So businesses are going to have to decide what are those high touch surfaces, what needs to be cleaned, such as restrooms, lobbies, conference rooms, light switches. Those are the kind of things you're going to have to take a look in your business of what needs to be cleaned. And depending on your business, it may be, in hair salons, clippers and things like that. There is a list of cleaning agents and disinfectants that are effective against COVID-19. We have to remember that some of these also could be hazardous. Not all, but they could be hazardous. So employees need to be provided with the SDS sheet on cleaning and disinfecting agents that they're using, not only to keep themselves safe, but that they use it properly, that it's stored properly, and if they need additional PPE, then they should have it. This is the EPA website up here, and this is a list of disinfectants that are effective against COVID. And I can't scroll down since this is a screenshot, but this site will help you find detergents or disinfectants that are useful. You may be using them already in your business, but this is a helpful website. This is a CDC guidance on cleaning, disinfecting public spaces, workplaces, and businesses. This is a really good decision tool here. This is a great website, and it will also help you in putting in place what you need for your business without like going crazy overboard, but doing what you need to keep your employees, customers. You've got to provide and maintain hand hygiene stations, including hand washing and soap and water. If that's not readily available, you've got to provide hand sanitizers throughout your organization. And the sanitizer, I think we all know by now that it has to have 60% or more alcohol. You've got to have a clean mindset and provide and encourage employees to use the cleaning supplies before and after use of shared and frequently touched surfaces. Anytime this is done, it has to be followed by hand hygiene. Hand sanitizers need to be placed throughout the business so that everybody has access to it. And this is a sad state of affairs when you can't really share a pizza, but shared food and beverages, buffet style meals really are prohibited. You've got to consider other places like shared amenities where you may have self-serve samples or water fountains, magazine areas, a communal coffee pot, or other food and beverages should not be shared. Also, a business needs to have trash bins throughout the facility where you can readily dispose of gloves, masks, or other PPE in a safe way. I think I went over the cleaning supply prior. This slide is a good one because it kind of triggers places that you may have to disinfect and clean, that you may have to keep a log that it was done. And so we've got communal areas, locations, and we've got shared objects that are shared between employees or employees and customers. Now this is not a happy slide. This has to do with if an employee or customer is COVID positive in your facility, that you've got to follow the CDC guidance for disinfecting a building and facility. Mainly, I mean, the highlights are that you close off the area that was used by the sick person. Businesses don't necessarily have to close their operations if they can close out the affected area. Outside windows and doors should be open to increase the air circulation. They want you to wait 24 hours before you clean and disinfect. If you can't wait 24 hours, wait as long as possible. The COVID virus is not that hardy on surfaces. It does survive. The longer you wait, the less contamination or viral load will be in that area. So that's why they want you to wait 24 hours. You'll have to clean and disinfect all the areas used by the person, offices, bathrooms, common areas, and shared equipment. Once it's been appropriately disinfected, it can be opened for use. Now, something a business may want to consider before you have to do this is there are certified cleaning services that specialize in COVID-19 decontamination, and you may want to have them vetted and in your Rolodex before you actually have to do this. This is the website that gives you kind of the detail of how to disinfect your facility if somebody is sick. The other thing, we've gone from protective equipment, face masks, gloves, and so forth, to sanitation. And now you've got to, as a business, you've got to communicate all this to your customers and your employees. One thing, and I mentioned this before, is in the second tab for your industry, the second blue tab is the guidance that's pretty detailed. At the end of it, you have to attest that you've read it and that you're going to implement it, either as the business owner or as someone who's authorized on behalf of the business to do that. You've got to put signage everywhere, inside, outside, to remind everybody who's coming into the facility how to adhere to the proper hygiene and social distancing rules, the proper use of PPE. All all employees have to be trained on these new protocols. You've got to establish a communication plan for everyone. This would be with instructions or signage. Could be on your website, a COVID link on what to expect, and conspicuously post your safety plan. And that is that third blue tab on the New York Forward website. This is a continuous log of every employee, visitor, or worker who may have contact with other people at your work facility. This excludes customers, and it excludes delivery that's performed with the appropriate PPE or through contactless means where you set up a separate delivery, so you don't have to, a separate designated site for pickup and delivery, so you don't have to worry about that. This applies to all phase 2 businesses except essential and phase 2 retail businesses, vehicle sales, leases, and rentals. It's recommended, however, to be best practices for these businesses is to maintain a continuous log. These businesses will need to screen employees, visitors, and workers, and document that screening was done. And in a lot of, in phase 1 businesses, the screening log can serve as your continuous log. Since you have to screen everybody who comes in, employees and visitors and workers, except for the company, the 2 industries I talked about, you can use this as a continuous log. If an employee, a visitor, or customer comes in close contact with others at the business and tests positive, you as the employer must notify the state and local health departments and start cooperating with the contact tracing efforts. And this also includes notification of potential contacts, such as workers, visitors, or customers, if known. While at the same time, you have to maintain the confidentiality of the impacted employee or customer, you as required by law, of sharing health information. So this is a fabulous site. This will save you hours and hours of work. You can put together, there are videos for training, there are guidance documents, there are print resources. You can use anything on this website as part of your communication plan, training for employees. There are beautiful posters here you can print out and just put all over the place. So this website will save you a ton of work. And here's some of the print resources. And here are a couple that I like, on the front door of your facility. And some information on COVID. It's all nicely done and easy to read. This, of course, is a real good one. The other thing, this is just as an aside, but you should be aware that OSHA put out guidance on preparing your workplace for COVID. This is these are requirements from OSHA, so you should be familiar with them. But I posted here, here's the website for that. And this is something you should review as well. With respect to process, there are 2 things in the process. One is the screening of individuals that come into your facility, and there's the contact tracing that's required. This employees who are sick should stay home or go home if they become sick at work. They're not allowed. They need to notify you if they are sick at home and not come into work. You have to implement a mandatory health screening, which is a questionnaire and temperature check before employees begin to work for essential visitors, but not customers. Best practices would include customers, but it's not mandatory. Ask about COVID symptoms in the past 14 days. Was there a positive COVID test in the last 14 days? Or were you in contact with somebody that was either confirmed or suspect with COVID in the past 14 days? And the 14-day window is that a person could be COVID positive, asymptomatic, and transmissible. So the 14-day window look back is necessary. Assessment responses from employees and essential visitors have to be reviewed every day. You have to ask this every day, and the review must be documented. The temperatures or symptomology cannot be recorded. All you can do is that I took the temperature, because both of those are privileged health information. You have to screen, the screener should be trained, and I'd be familiar with the CDC, the Department of Health, and OSHA protocols, and wear appropriate PPE, which includes at a minimum a face mask. While you're doing the screening, if there's a queue for people who are coming in, you want to maintain social distancing markers so that everybody's not bunched up together. So here's an example of a screening log. This is me. So I came in, I'm an employee. I had my temperature checked. I had my symptoms checked. And if I had an exposure, I got checked. And yes, I was allowed to come in the facility, and this is who screened me. Over here, we've got a visitor, and we took his temperature, we took his symptoms, and we did an exposure check, but he was not allowed into the facility and was told to inform their employer. Here, an employee also was not allowed into the facility. He probably answered yes to some of these. He failed the test and was told to talk to his healthcare providers. Employers have to document that a screening was done and that the review is going to be used to perform contact tracing with the Department of Health. Here you have a list of who entered your facility and that they came into your facility and by day. You'll want to identify a point of contact party for workers and visitors to inform if they are later experiencing symptoms. So someone at your facility could be your HR person, it could be your operations manager. I don't know who would be appropriate in your facility that visitors, workers are to call and say that either they had symptoms or they tested positive so that that person can take action. So any individual with the following conditions can return to work only after completing 14 days of self-quarantine. If a person has symptoms and either test positive or didn't receive a test, after 14-day quarantine, they can come back to work. If a person does not have the symptoms but are positive for COVID, they can come back to work after 14-day quarantine. If a person has had close contact with another person with COVID for a prolonged period of time and is symptomatic or is not symptomatic, they have to self-quarantine for 14 days. A person who screens positive for these symptoms, and we're going to go into the symptom screening in a minute, will not be allowed to enter the facility and should be sent home to contact their healthcare provider for assessment and testing. You need to have a plan in place for cleaning and disinfecting and contact tracing in case you have that positive case. Now, I'm not going to talk too much about this, but in phase 1, some essential businesses allowed employees that were exposed to someone with COVID to come to work with monitoring as long as they didn't have symptoms. This is not applicable to phase 2. Asymptomatic employees with an exposure to confirmed or suspect case, just exposed, must self-quarantine before they can come to work, as I talked about in the previous slide. I know this looks busy, and I use this on my phase 1 webinar, but I'm going to walk you through it because these are the screening questions you have to do. There are 2 parts to it. There's a symptom part and an exposure part. If an employee or visitor answers yes to any of these, they're not allowed in the facility. And if they answer no, they can go on to the exposure screening. The exposure screening, in this case, have you had close contact in the last 14 days with someone who was either tested or has symptoms of COVID? If the answer is yes, they're not allowed on site and they have to quarantine for 14 days. If they answer no to the symptom screening, they may they may come into work. This close contact is defined as being within 6 feet for at least 15 minutes. If you don't know, if you're not sure of either the symptom question, if somebody has failed that question or failed this and you're not sure to the extent of exposure is not clear, you may contact Orange County Department of Health for guidance. They'll instruct you what to do. And here's the Orange County Department of Health number, the main New York State number, and the COVID hotline number. With contact tracing, if an employee is tested positive, you have to notify the Department of Health, both New York State and the local health department. In the case of an employee, customer, or visitor who interacted at the business test positive, you've got to do these things. You've got to cooperate with the local health department to trace contacts in the workplace. You've got to notify the health department of all employees, logged and visitors, and customers as applicable, who entered the business going back 48 hours before that employee either had COVID symptoms or tested positive, whichever comes first or whichever is earlier. You've got to maintain the confidentiality of the individual as required by law, the one that was tested positive. This contact tracing is looking at the people who were in contact with that employee, customers, visitors, and other employees. And this is why that continuous log is so important in helping isolate those people who might have been exposed. The local health department, upon notification, may implement monitoring and movement restriction on the infected or exposed persons. And this may include home isolation or quarantine. Employees who may, not through the workplace or out and about or with relatives, are notified or alerted that they've come in close contact through tracing with a person with COVID, then they are required to self-report this to their employer at the time of the alert. And they have to follow the protocols as if they've been exposed at work, which means the 14-day quarantine. This daily screening review may be used to perform the contact tracing, as I said. For employees who are symptomatic or test positive for COVID, contact tracing will be required of those employees, again, for 48 hours before they became symptomatic or tested positive, whichever is earlier. So you've got to have a way to monitor or go back and look who that employee interacted with 48 hours before the symptoms occurred. Now, these are mandatory requirements specific to phase 2 businesses, and I'm going to go through each one. Everything I just talked about applies to everybody, but what I'm going to say is specific to each of these, and they each have a little twist that's different. For office-based businesses, there's sometimes shared workstations. This, the phase 2 reopening calls them hot desks that must be cleaned and disinfected between users. This may be one of those items that is on your cleaning log, that these hot desks are cleaned. Non-essential common areas remain closed. And I don't know about you, but I've never worked in an office that had a pool. So I guess I'm in the wrong business, but these areas, or a gym, these areas have to stay closed. Provide building managers and owners a list of essential visitors expected to enter the building. A lot of office-based businesses lease or rent from a commercial building management firm, and building management firms also have phase 2 reopening requirements. So there's a real hand-in-hand between the tenant, the office-based business, and the commercial building management firm. And each one will have to make an arrangement of how this is going to work. But the requirement is that the office-based businesses are responsible for their leased space and employees, but there is some collaboration that can occur and is encouraged. The office-based businesses can coordinate with the building managers to facilitate the screening. And as I said, the tenants, the office-based businesses, are responsible for screening their own visitors and their own employees and visitors, unless there's some arrangement to have an alternate. The business management firm is going to do the screening. With respect to real estate, limiting of distance, limit the use of cloth, disposable or other face coverings for workplace activity that require a higher degree of PPE due to the nature of work. If you need an N95 to do your work, a face cloth will not suffice. I think that's what this is saying. I'm not sure what additional PPE is required in real estate, but it's just saying you can't exchange a higher level, you can't exchange a lower level of the cloth mask for something that requires a higher level of protection. Non-essential common areas remain closed. If shared building space is used by sick workers, shut down those shared spaces, elevator lobbies and entrances, and you'll have to follow the CDC guidance. I think everybody does if someone is ill. Tenants are responsible for screening their own employees and visitors, but the management and tenants can coordinate the facilitate screening. This is kind of like the office-based screening. Residential in-person property showings and related activities. Their showings are only allowed in unoccupied or vacant properties. The current owner or leasee is not inside the property. Again, they just want to reduce population density and take out of the equation non-essential personnel. Everybody visiting the property will be required to wear a face covering at all times. You'll need to clean, replace or clean and disinfect with gloves after every showing as applicable. This is also high touch areas such as handrails and doorknobs before and after every showing. For real estate, this may be part of that cleaning log, is you're doing this on these high touch surfaces. And it goes without saying you can stagger your showings to avoid a congregation of people. Open houses are only allowed with one party inside the property at a time. Essential and phase 2 retail. Essential grocery stores, pharmacy, and so forth is phase 2, like bookstores, shoe stores, and so forth. Ensure that fitting rooms are equipped with the appropriate cleaning and hygiene supplies for employees and customers, and this would also include readily available hand sanitizers. Any amenities should be closed, like self-serve bars and samplers. At the checkout, employees must wear face covering, and if necessary, employers can enact physical plastic shields, and we've seen them everywhere we go, as long as they don't impact airflow, heating, or cooling, or ventilation. OSHA has some requirements with respect to this, so you can check there. This is like the security guard. You want to designate a site safety monitor to make sure that employees and customers alike are compliant with the business plan you've put in place. For vehicle sales, leases, and rentals, if an employee accompanies a customer on a test drive, the employee must sit in the seat furthest distance from the customer and wear a face covering. That's the only difference in vehicle sales. This is retail rental, repair, and cleaning. This is residential cleaning. This is like appliance rental, appliance repair, and so forth. I'm not sure about fitting rooms, but this was in the guidance. Employees should practice hand hygiene, washing with soap and water for 20 seconds after handling laundry or cleaning or disinfecting rented or repaired equipment, or in the homes from individual customers. ensure that equipment and goods are disinfected before the customer picks them up and after they drop them off. You want to sanitize hands before and after transferring goods or customer visits. If providing equipment or goods for rent or repair services, clean and disinfect the equipment or goods before it's picked up by the customer or after the customer drops it off for return. If providing cleaning service for in-home cleaning, sanitize all equipment, vacuums, buckets between each use and location. Commercial building management will have a lot of collaborative efforts with office-based. There's some things that are a little different. All non-essential common areas should be closed. There may be workstations, lobbies, and so forth that could be considered a hot desk that needs to be cleaned and disinfected between users. It's also recommended prior to reopening that commercial building management complete a pre-return check to make sure that the HVAC and mechanical systems, water systems, and so forth are functioning. You may need to receive verification for suitability of occupancy from building engineers before people come back into the building if they have been not occupied for this time. With respect to communication, coordinate with tenants to get a list of essential visitors so you know who to expect entering the building. Tenants are responsible for screening their own employees and visitors, but an arrangement can be shared between commercial building management and office-based. It's dependent on your relationship. The governor signed an executive order allowing commercial buildings to conduct temperature checks for people entering office buildings as employees start to come back. This may be above and beyond the screening. It's just to check a temperature of anybody that's coming in. You would still have to do the screening questionnaire, but this is a temperature check. Hair salons and barbershops. Ensure that your seating for customers allows a 6-foot distance from others except the employee that's providing the service, unless you have a physical barrier in between the barber chairs or the salon chairs. All amenities need to be closed, the magazines, the water fountain, samples. Employees have to wear gloves when providing service, or they can sanitize their hands before and after contact. If gloves are used, they have to be discarded after each appointment. Employees have to wear smocks or gowns. And if providing coverings to a customer, the coverings have to be disposable or they have to be cleaned and disinfected in between use. The services offered also must not require the removal of the mask, like getting your whiskers trimmed. So that one. It is recommended or required rather that hands are washed for 20 seconds with soap and water before and after providing service to each customer. This is kind of what nurses do and healthcare providers in between patients, if you think of it that way. Clean and disinfect the workstation and tools, chairs, brushes, and so forth between each customer. Cleaning and disinfecting of the hair salon, shared surfaces, as well as other equipment should be performed using those agents that are effective against COVID-19. You may be using some of those solutions and cleaning agents now. You should leave about 15 minutes in between appointments so that you don't have people waiting, and that you have enough time to fully clean your workstations and equipment. This is something that I kind of caught me off guard as a surprise, that hair salons and barbershops have to ensure that the employees who are providing the services directly to the customer are tested for COVID through a diagnostic test every 14 days. This is in place as long as the region that the hair salon and the barbershop is located remains in phase 2 of the state reopening. This is a fun one. I've been waiting for this one. This is restaurant services, and it already in place has been takeout and delivery food services. But what's new in phase 2 is you get to sit outside and be served a meal. So in outdoor spaces, every table with seating has to be 6 feet apart from other tables, other seats, and patrons. Has to be away from a thoroughfare where people walk through. You also have to ensure the indoor capacity accommodates patrons who have to either come into your facility to access outdoor seating or restroom or payings, and allow access in a socially distant manner. Indoor dining is closed. Indoor dining and seating is closed at this time in phase 2. Employees have to wear their face coverings at all time. Patrons must wear their face coverings at all time except while seated, provided they're over the age of 2 and medically able to tolerate it. Limit outdoor capacity to the number of tables that can be arranged such that there's a minimum of 6 feet between the tables. Whenever distancing is not feasible between the tables, you can enact physical barriers. And the OSHA document I showed you would give you some ideas of what you could use. Individuals in the same table and in the same party can be up to 10 people. They can be from different households, but they come in the same party. Communal tables are only permitted if 6 feet can be maintained between the parties. You've got to have clear signage, spacing, and any lines if you've got customers waiting to order, to pick up the food, or to be seated, even to use the restroom. You may want to designate entrances and exits for customers and a separate entrance and exits for employees when possible. Ensure that employees are wearing their face coverings. We've said that already. If employees wear gloves during non-food preparation activities, make sure that they replace the gloves frequently and encourage them to change gloves when switching tasks. If they're not wearing gloves, they have to wash their hands frequently between tasks. Ensure that employees who are bussing tables wash their hands with soap and water, and if they wear gloves, replace these gloves before and after disinfecting the table, and they should follow that with hand hygiene. Before returning to work, restaurants need to complete a pre-run check and assessment of the kitchen systems to make sure they're healthy and safe. You want to minimize the sharing of kitchen equipment between staff. For takeout, have hand hygiene stations for customers who are waiting for food or drinks. Ensure that your staff wash their hands with soap and water or use hand sanitizer. If the pickup is indoors, ensure doors and windows are open to allow for good ventilation. If you provide condiments to customers, make sure they're in single-use disposable containers. If non-disposable menus are used, you have to disinfect the menus between each party's use. And use pre-packaged silverware or pre-rolled silverware. And silverware that is pre-rolled, the employees must wear masks and gloves. As of yesterday, places of worship were permitted to open with a 25% occupancy and social distancing. And this is in the 7 regions that have already entered phase 2. Today, it looks like New York City is opening. The percent of cases have dropped considerably, and New York is entering phase 1. So I'm wishing everything goes well. This is, I believe I took this snapshot yesterday. It's one of the highest in the region of cases in Orange County relative to its neighboring counties. You can see that the number of cases have plateaued, it's not on the rise. Hospitalizations and so forth have dropped. And those slides were just to remind us of why we're twisting and turning with all these phase 2 requirements. And I think I've said everything that I can, and I'm open for questions.
Great. So as a reminder to everybody, thank you, first of all, Petra. That was, again, fantastic and thorough. As a reminder, the original webinar, the phase 1 opening, where you referred to it a lot about some of the procedures, is available on our website. In addition, this presentation will be available on our website, both the recording and a PDF of it. So you'll have the ability to go through it or listen to what Petra said again at a later time. So we do have a few questions. The first one that I would say is that, not that I would say, one of the first questions from Angela is, do you need to screen employees for office workers? So I'm assuming, and if Angela's listening, okay.
Yes, it's mandatory.
Okay. So then
everybody, if I may say, with everybody that enters the facility, except for customers like in a retail, you don't get your temperature checked in a grocery store, that kind of thing. But employees must have a screening, and visitors. And visitors could include service people, that come in and service something in your facility.
Mm-hmm. Makes sense. And I'm assuming too, like in the salon situations where you have maybe a front portion, like, reception area or receptionist, and then stylists, obviously doesn't matter. Every single one of those entities or every single one of those individuals would need to be screened, correct?
Yes, they would. And you wouldn't have a reception area since that's closed.
Right.
There's so yes, and your employees are going to be together for more than 15 minutes at a time. And therefore, there's the possibility of exposure, asymptomatic exposure. So if they're together for the workday, they're getting a screening. Best practices would include customers. And for more specifics, those tabs that I showed at the beginning spell it all out in gory detail. There'll be no doubt what your business needs to put in place.
Great. Another one is you mentioned a few times that you can't, obviously some masks aren't reusable, but you had said that some of them, and maybe face shields, are reusable provided they're cleaned properly.
Yes.
What's the best way to clean a mask or a face shield? Is there guidance for that as well?
There is guidance, and that would probably be on the CDC. The EPA has a list of what is effective against COVID, and then the CDC would have guidance on what can be cleaned. There's certain disinfectants that would cloud plexiglass or that kind of thing. So I don't have that off the top of my head, but those are the places you would look for how to handle that.
Okay. And you had the link for the CDC in the presentation, right?
Yes.
Okay. So I know we just got a question from Hannah asking about the website. So when we post this presentation on our website, which is ocnyida.com, and when we have it on there, you'll be able to access the CDC.
Yes, on that slide that shows that information where you can go to. It shows the website up in the the address bar.
Perfect. The next question is, do commercial tenants have to supply copies of their screening logs to landlords on a regular basis? Or
No.
if they have COVID-19 contact issues?
No, you don't have to show them.
Okay.
So the office-based workers have to screen their employees and visitors and keep that screening log. You may have to share that log with the Department of Health Tracing in helping them try to, see if somebody was tested positive, who did they work with within the last 48 hours. That may be they stopped at in a reception area at the commercial building, and that, in that case, that employee may be the commercial management, commercial building management, employee, and then they would have to be informed that they were exposed of that. But no, you don't have to share that. And, you know, depending on how employees and how visitors enter into your business, whether it's directly or you have to go through a lobby from the, you know, the building owner, that you know, it depends how you're going to set that up. But no, you don't have to share that.
Okay. You had also mentioned that some entities can use cloth masks and some may need N95s or face shields. Is there guidance also on what kind, where the line is between if I need a cloth mask or an N95?
Okay. Yes. OSHA has requirements for work now, pretend we never had COVID.
Mm-hmm.
There are situations where you have to wear an N95 mask, whether, you know, it's either fumes or the chemicals or, you know, even tuberculosis in a hospital, you know, if you're a healthcare worker, there are situations where you have to wear a higher level of protection. And this has not changed. That guidance is just saying you can't replace a cloth mask for things that you needed a higher level of protection to begin with in the first place.
I see.
Sense.
Okay. How will New York State enforce the adherence to COVID practices?
Okay, that's a good question. First, you have to attest that you're going to do it. And secondly, God forbid you have an exposure. What's going to happen is the Department of Health will get involved and they may come on site. You know, this is also OSHA compliance. It's not just New York State.
Mm-hmm.
This involves employee safety at the workplace. So you expose yourself to, you know, some fines or other issues if you don't have a good mitigation plan in place. They don't come and monitor you, but if you have an incident, just like if you had an incident at work with an employee fell off a ladder or something like that, it would involve OSHA and you know, the state perhaps. So,
Okay.
If that makes sense.
Yeah. So Hannah's asking another question about customers. So I know you had mentioned that in certain retail operations like grocery stores, you won't be screening customers every time, but in some smaller businesses, maybe salons, and I'm not sure what kind of business Hannah has, but do customers need to, if it's a smaller place, do customers need to be screened entering and exiting?
It is considered best practice, but it's not required.
Okay.
And depending on what Hannah's business is, there is that quick cheat sheet where it says you must put this in place. And then it says on the other column, it says recommended best practices. When you read the guidance, the more detailed, lengthier document, it makes those suggestions, but it's not mandated.
Okay. And that's also within this presentation, so we can.
Yes.
There. Okay.
Well, the New York Forward site spells it out. Depending on the business type, you click into your business type and look at the guidance. And since you have to attest that you've read it and you're going to implement it, you will become familiar of what you need to do. And I think the hard part for businesses really is, how do I translate this to my company? How is it going to look in my company? And the more you go over it, the easier it really becomes. And you have control of what you're going to do within your business to maintain social distancing. It may look different in every business, and the whole, the screening and the whole thing. True. It's a lot. I know it is a lot. And if you haven't been an essential business or already in phase one, this is, you're just trying to get back on your feet and open the doors. And now you've got, all of this to sort through and try to, you're trying to do right. You're trying to do the right thing. But it's pretty much, it's spelled out. it's step by step in those very first slides that I have on the New York Forward.
Mhm.
You go in there and ask yourself, how is this going to look in my business?
Gotcha. Another question is, I know that there was a recent executive order signed about people who visit sites and don't wear masks. For instance, retailers can turn people away, but does that kind of extend to all businesses? Can a business choose not to serve a customer that won't comply with COVID prevention
Yeah,
practices?
yeah, yeah.
Okay.
But remember, you have guidance that it, if you can maintain beyond 6 feet,
Mhm.
then then you don't have to wear the mask. But if you're going to, as a business, you can lay down the law and say nobody comes in without a mask. Nobody comes in without shoes or a shirt. I mean,
Right.
a business can say that. But in the outdoor dining, for example, you have to take your face mask off as long, and that's okay. But the restaurant has to make sure that the table next to them is 6 feet apart.
I see.
And you keep people 6 feet apart. The people who are coming in a group of 10, whether they're neighbors or family, if one of them gets ill, it's contained to that group of 10, as long as they wear face masks and they're 6 feet away from other people. But the other thing to remember is some people have medical issues about wearing a mask.
Mhm.
Asthma, or I don't know, they just have some medical issue. Um, and that becomes a little tricky, but the guidance says if you can maintain 6 foot apart, on isolated, that you don't need it. But a business can decide, depending on what they can control. Sometimes you can't control people walking in an aisle together that's closer than 6 feet, then they have to wear a mask.
Right. Of course, that makes sense. I know summer camps are starting to reopen. I don't know in your research if you've noticed, but are there any requirements for camp counselors to meet in terms of like frequent testing, anything like that?
No, and um, if camps and camp counselors and all of that is in the subsequent phases, if you click on phase 3, like
Mhm.
nothing. So, they're writing it as we go. And I have to remind everyone that these phases are not permanent. These phases are highly dependent on the 7 metrics. And if things start to slip in the metrics, we may go back to where we were. And it's concerning with, what's going on in the country and the big cities, and people so dense together, even despite face masks. What impact is that going to have in 2 weeks?
Right.
Cities, including New York City, which, on top of the demonstrations, they're reopening in phase 1 today.
Right. Last question is, are there different rules or processes for essential versus non-essential businesses to follow during reopening?
Yes, yes, there are. One of the rules, and I mentioned it briefly, is if you had a COVID exposure, or either somebody was positive or they had COVID symptoms and you were exposed, as long as you didn't have symptoms, you could come to work. And the reason for that was firemen and policemen and groceries, if if they may have an exposure and now they're out of the workforce for 14 days. So CDC had guidance that you could monitor the employee, the screenings and all of that for these employees. And the other thing with the essential, I think the difference with the essential and what's in essential businesses and now phase 2 businesses is time. Essential businesses have put these practices in place like immediately. And you're all familiar with them wherever you go. If you go out in public, about, direction in an aisle, stand 6 feet away from here, plexiglass or yeah, I guess plexiglass screens are everywhere. So there are some differences. I don't know, except for the one about the exposure. I'm not sure if they're what the difference is. They still have to do everything that we're doing now with social distancing, PPE, screening, contact tracing. All of those apply.
Right. Well, it makes sense. And, that being said, we don't have any further questions, but I would like to thank you, Petra, so much for the work you've put into this and for guiding us through this definite uncharted territory. I think that, as we move through each phase, it's a little bit more, well, it's not easier. It's not necessarily, easy, but it's certainly more, we're getting used to it, I guess, right? So I do appreciate it. As a reminder, again, I know I've said it a few times, but all of this information, the PowerPoint, the recording of the PowerPoint, will all be available on our website, ocnyida.com. There's a COVID page. There's a button right in the middle of the home page that says COVID relief. You click on that, it takes you to a whole host of resources. So not just these webinars, but also SBA resources, federal resources, all sorts of information out there, including even job postings and the ability to post open jobs if you have open jobs that you need to fill. So all of that is available on our website. As a reminder, next week, June 18th, which is Thursday at 10 a.m., we'll have another session. This one will be focused on the new regulations and guidelines for forgiveness of the payroll protection plan. We'll be sending out the registration information today, or I'm sorry, we'll be sending it out by email. I'm not sure if it'll be today, but you can check our website certainly at ocnyida.com for details. Once again, Petra, thank you so much for putting this together and for guiding us through this process. And thank you to all of our attendees for spending your Monday morning with us. And we will hopefully join you all again on June 18th. Thanks, everybody. Have a great day.
Thank you.
Thanks. Bye.